starting from growth factor solution, and then exosomes, in the future biosomes, are the key to success in every procedures that you are making inside the office. So just a quick introduction. My name is Guy. I'm a doctor practicing aesthetic medicine in Israel. I'm working in my private clinics, and also I supervise the aesthetic department at Hillel Yafa Hospital. I manage also a big energy-based device center in the north for movement and aesthetics. I have master degree in aesthetic medicine, and I'm pursuing my second master degree in clinical dermatology. I have postgraduate certificate from Harvard in energy-based device and their application in aesthetic medicine. And in my clinic, I treat a lot of skin indication, a lot of dermatological pathologies with many energy-based devices. I have the privilege of serving as a key opinion leader for Anti-Age, but also for many other esteemed international aesthetic companies. When speaking about regenerative medicine, we always start and speak about the fibroblasts, because the fibroblasts are more extensive studied than other cells. The fibroblast has an amazing capacity to proliferate and to change. But as they age, they change. And they change in many ways, but in their function they decline. Their proliferative capacity decreases. They become dormant, they become silenced. And we call this state a senescent state. Senescent state means a dysfunctional state. The fibroblasts start to speak in different language. All the cells become speaking in different language. They become dormant, sleeping, not producing, not proliferating. And this is the problem because it affects the tissue. This chronic state of inflammation or of production of inflammatory cytokines is called also the inflammaging. And what does it mean? Senescent fibroblasts are not cleaned by the immune system. They have very, very good stability in the tissue. They are not cleaned. They stain the tissue and they keep secreting inflammatory cytokines. Always inflammation, and it never ends. This is why in the tissue there is always chronic inflammation. But it's not only the cytokines that they secrete. Their gene expression change. They start to behave different, to secrete different cytokines because of their change in the DNA. The elastin, the collagen production is decreased because of change in the DNA. And most importantly, the MMP production is increased. And what MMP is doing is very bad. It dissolves the collagen that is connected into the fibroblast. And when it dissolves it, it creates a vicious cycle because the collagen amount is decreasing. The tension on the tissue decreases, the fibroblasts secrete less collagen, the tension decreases, and it's a vicious cycle that creates only damage to the cell. So I wonder if you know that the fetal cells behave different than adult cells. In fetal skin, when a damage is created, the cells will proliferate and become regenerative. They produce new cellular layer. But in the adult skin, no. Damage will create scar. And the major difference that creates these differences between skin cells of fetal tissue and skin cells of adult tissue are the produced cytokines. We know that in fetal cells, the M2 or the macrophage type 2 is very strong, while macrophage type 1 is no. And in adult, the exact opposite. Macrophage type 1 is very powerful, macrophage type 2, not so much. And the difference in the macrophages is in their secretion of cytokines. Macrophage type 2 will secrete TGF-beta3, it will secrete IGF, interleukin-10, and regenerative cytokines. But macrophage type 1 will secrete TNF-alpha, interleukin-6 and 8. It is inflammatory macrophage. And in the end, this is the main difference between the reaction of the fetal fibroblast to the adult fibroblast. The stimulation from the So the basic growth factor that we need to know in order to understand regenerative medicine are the same growth factor that produced by celestial laboratories and are in the growth factor solution. The first one is IGF-1. IGF-1 is a very potent growth factor. What is surprisingly, or not surprising, is that in young adult skin, we have a lot of IGF-1, but also in the rejuvenated adult skin, a lot of IGF-1. However, in the geriatric skin, the adult skin that is not rejuvenated, very, very low amount of IGF-1. So it means that IGF-1 control proliferation and collagen production. But IGF-1 is not everything. IGF-1 knows how to stimulate cells, it knows how to proliferate fibroblasts, but TGF-beta-3 is similar in its importance. Because TGF-beta-3, unlike TGF-beta-1 and 2, is anti-inflammatory, anti-scar or anti-fibrotic, and in the same time, it can result in proliferation of endothelium, so it can create new blood vessels. It is optimal for regeneration. And the last one is to speak about is the interleukin-10. Interleukin-10 is an anti-inflammatory cytokine, and it results in the biggest difference between the fetal skin to the old skin in the regenerative capacity, because inflammation means decreased regeneration. We create inflammation with energy-based device every day, but inflammation can be good or can be bad. Can be with macrophage type 1 or macrophage type 2. And the difference is because they secrete different cytokines like interleukin-10. So the fibroblast, no matter which energy-based device did you use and which injectable you use, all the time you will get macrophage type 1 and 2. Every time you have good device, you have good injectable, you will get more macrophage type 2, but still you will get also macrophage type 1. So application of growth factor increase this ratio, because if I can make even more macrophage type 2, more than what I could make with only good device, then the ratio is much bigger. Addition of polynucleotides even make it more efficacious. So I'm using every tool that I have after every procedure to have mainly macrophage type 2 in the tissue. Every tool that I have, including anti-age products, speaking today mainly about exosome and biosomes. So what are exosomes? Exosomes are tools that we use in order to make regeneration, in order to make more macrophage type 2. We can use it as a standalone, and we can use it in combination with energy-based device. We can use it in combination with injectables and everything that we want in order to make regeneration. Like my colleague said earlier, they produce by extracellular vesicles. They are like extracellular vesicles by exocytosis from cells. Every cell creates exosome. Every cell uses exosome for communication. But stem cells exosomes are more potent because they communicate better. This is why usually we use stem cells to produce our exosomes. As spoken earlier, there are many sources of exosomes, and we know today that two powerful sources are the bone marrow mesenchymal stem cells exosome and also the umbilical cord stem cells exosome. And their difference is in their different components, because both are powerful, both create proliferation, but the bone marrow exosomes different, because the bone marrow exosomes produce different proliferation, they are diverse, they have a lot of growth factor, and they can be applied for many indications. The umbilical cord exosomes are different from the bone marrow because they have more proliferative and differentiated different, so the exosomes or the communication system is different. And we have a wide variety of signals when we combine them together. So the first strength of anti-NDX exosome is that it contains hybrid technology. It contains both bone marrow exosomes for their diverse abilities and umbilical exosomes that contain different proliferative and differentiative capacity. Together, we enjoy from both worlds. The exosome inside them contain, of course, growth factors, as we spoke before, but not only, they contain also microRNA and messenger RNA. MicroRNA is important for some epigenetic stimulation and some difference of the tissue reaction. And the messenger RNA will increase protein synthesis. So they have both stimulatory effect, but for every cell, not only for fibroblasts. This is why growth factor are our main interest, and not the RNA. And the function of the exosome differ because they react with different cells. Some cells that will contact the exosomes will result in their apoptosis. Some cell proliferation. Some cells anti-inflammation. It depends which cell they will contact. The same exosome, different receptors, different cell interaction. And this is the main difference. Speaking about anti-NDX and why it's called the real exosome, what makes it differ from other competitors is, first of all, their size. Exosomes should be in particular size in order to be real exosomes, in order to be able to penetrate the cellular membrane, in order to be able to cause some change in cellular behavior. And this size is around 100 nanometer, which anti-NDX has. Second thing, lipid bilayer. Real exosomes should be enveloped by lipid bilayer that is similar to the cellular membrane. This is how it can penetrate very effectively into the cell. And the third criteria, I think, is the most important. And it is the markers on the cells, inside the cells, positive and negative marker that show that this product is real exosome. If it does not contain the marker, it is not exosome, because it is not created by cells. So how we produce these exosomes? Starting by culturing, we take bone marrow stem cells and umbilical cord stem cells, and we make them proliferate. We take from this proliferation, from this plate, we take the growth factor, and then we do purification. What is purification? Is taking all these cells material, what the cell produced, and taking from it only the exosomes. We are doing it with a various laboratory method like TFF and SEC, but afterward we get only exosomes, nothing else. And we can see it, first of all, according to the size. Remember the size? So the size, we are taking only the fraction that contain particles with a 100 nanometer size. And second, the marker. So the CD80 marker, CD81 marker is the marker for exosomes, and we take only this particle. So we are taking only the correct size with the positive marker of CD81. For comparison, you can see in front of you other competitor. So even if we have the same amount of particle, it doesn't mean that they are in the same size. So the green one is the anti-age, and you can see it's around 100 nanometer, and the competitor can be different. It can be something else, not exosome. Second of all, we prove the carrier with the transmission electron, the lipid bilayer. So we can see that it is circled or enveloped by lipid bilaminar layer. And third, we see the plate assay. And the plate assay is checking both positive extracellular marker, like CD8, CD81, and CD9, both intracellular marker, like ALIX, and both negative marker, like Kalanick C, which mean that they are the perfect exosomes. In comparison to other competitor, some competitors have particles that are not enveloped at all, or enveloped not by a lipid bilaminar layer. Some competitors have negative marker, so it can be everything in the competitor vial. It can be salt crystals, it can be non-extracellular vesicle. Only when you have the three criteria, you know that you have real exosomes, and Andreas has them. So, speaking about criteria is nice, it's okay. The cells behave good, the extracellular vesicles are real exosomes, but in Celeste laboratory, they checked also its functionality. And we can see the green small dots, the exosomes, and how the cell take them, the fibroblasts take that exosome, and they are put in the perinuclear localization, which means that not only they are real exosome, they are getting into the cell and they are getting to their right position. So preservation of exosomes is very important because we want exosome to be good from the minute produced until now. We do not want some damaged exosome that was good in the lab, good functionality, but in the real life it didn't work. And so the preservation of anti-Ag MDX is by lyophilization. Lyophilization is a process of drying the exosomes in order that they will have a long-term stability and their concentration will still stay high. And anti-Ag MDX have very, very long stability. They check it up to 9 months after production and the concentration stayed similar. Only with this 20% dropout, which says that it's still more than 10 billion exosomes. Much more. Still bilaminar lipid layer, even after lyophilization, and still stable, which means that the product will stay good for 9 months for sure. What about checking the real ability to function? Because, okay, the cells get the exosome, they are in good condition, but still, are they making some function? And the answer is yes, because checking the anti-inflammatory action, for example, you can see in front of you that anti-Ag MDX together with Th1 cells, macrophage, will result in decreased stimulation or decreased cytokine secretion that are inflammatory, so less inflammation. Moreover, you can see in the lower slide the INOS. INOS is a marker of macrophage type 1. And if I take exosomes and add it to the macrophage, and in the end I see no green light, okay, no INOS, it means polarization. And it means that in the tissue there are main macrophage type 2, not type 1. Second, proliferation. So the cell proliferates, taking in vitro cells, human dermal cells, and also taking hair cells, they proliferate, and we can see increasing their proliferation after exosomes. So what are biosomes? I mentioned biosomes earlier, and biosomes are the future, in my opinion, of regenerative medicine. Because biosome is synthetic vegan exosome, not human-derived, completely synthetic. Most of us here will never see the difference between a natural diamond and synthetic diamond. I cannot see the difference. For me, it's look the same. And as I do not see the difference, the cells do not see the difference either between exosomes or biosome. If you produce a good biosome, then it will look like a normal exosome. Because biosome is produced from the same component of exosome. The layer that surrounds the biosome is exactly the same like cellular membrane, and it contains phosphatidylcholine and sphingomyelin and cholesterol, everything that component of the cellular membrane. So it will look identical to the surrounding of the exosome. And inside we are putting growth factor. The same growth factor that are in the growth factor solution, the same synthetic but fully 100% mirror image of the normal exosomal growth factor. No microRNA, no messenger RNA, only growth factor. The growth factor is produced by recombination. It's like we produce insulin or every other protein. We are taking the DNA, put it inside the plasmid inside E. coli, and the E. coli produce for us a synthetic growth factor. Taking this, we can see the ratio, and we can see the size of the growth factor, and then we can take out only the growth factor, without all the other things that contain inside the E. coli, only growth factor. But growth factor that are comparable to the exosomal growth factor. They are so comparable to the growth factor inside the exosome that we can compare them. Their size is very similar. Even though the biosome is a little bit smaller, you can see they are still both of them in peak of 100 nanometer, which means both of them are in the perfect size. The biosome is a little smaller, this is why it can penetrate better. The lipid bilayer, same thing, same. Lipid bilayer of exosome, lipid bilayer of biosome, similar, same thing. Their function, similar. You can see differentiation and proliferation of epithelial cell, of fibroblast, and collagen production. Both produce the same effect. This is what makes biosome very compatible and comparable to exosome. Checking a wound scratch assay to check the regression, similar. If you take a biosome and exosome, the same amount of migration of fibroblast will be in the tissue, so they make the same differentiation and function. So taking it back into the clinical world, let's speak about regenerative medicine. I use the biosomes, exosomes, and growth factor solution for rejuvenation, for hyperpigmentation, and for hair regrowth. I use them also for scars and for other indications, but these are my main interests when I use regenerative medicine. All these products can be applied either by microneedling or by energy-based device. Okay, so I'm using, for example, TMFI here, the tip cell, in order to deliver these particles. But I can use also microneedling and then apply the product. Similar, then the product will get into the cell. My combination protocol, speaking about rejuvenation, is preparing the tissue by mesotherapy, that they will have all the things that it needs, amino acid, antioxidant. Then adding a good biostimulation, for example with HIFU and polylactic acid, to get stimulation of all layer, but always, no matter which device I use, no matter which injectable I use, I will always support the process with biosomes, exosomes, or growth factor solution. Because I want good M2 reaction. I want good stimulation. I want regeneration and not inflammation. Speaking about good biostimulation, I will always do multi-layer biostimulation. I will start with the SMAS tissue and then I will go into the dermis, but I will stimulate all layers. And with one session only, but good session, delivering good product, you can get very nice rejuvenation. I took a patient hand in order to show it on the hands, which is very hard to treat. And in this treatment, I use the TMFI technology, but with low parameter, no ablation, only delivery. And I delivered the growth factor solution, which is similar in their component to the biosome, in order to make and show this regeneration and how the skin looks better. But it's not just that it looks better. The vascularization even decreased, because when tissue behave better, they are making less inflammation, and less inflammation means less vascularization. So then you can get very easy decrease of redness, decrease of inflammation, and good tissue stability. Looking on the periorbital area, so yes, decreased vascularization, but also decreased pigmentation. This is for one treatment only. Low parameter of TMFI, just drug delivery, using the growth factor solution. And then I used and I showed the big difference. The big difference also in pigmentation. So the area, the periorbital area, just after one treatment, with no big changes with energy-based device, only with the application and delivery of regenerative products. You can see much nicer look. The lower eyelid area that is very, very hard to treat, it's very thin skin. With regenerative medicine, you can treat them because the skin will behave better and will have less wrinkles and rickets. And our model here, the VP sales of anti-age, was also treated with the biosomes, and you can see decrease in vascularization and decrease in pigmentation, decrease in rickets, in the periorbital rickets. It means that every parameters of the skin changed. Every parameter get better. What about hyperpigmentation? So for hyperpigmentation, I always combine multi-treatment because there are many factors that control hyperpigmentation, especially when we are speaking about dermal hyperpigmentation like melasma. Then I use Q-switch laser, but I add to the Q-switch laser also topical solution that contain the tranexamic acid and growth factor. And the reason is because we know today that dermal hyperpigmentation is created mainly because of incorrect cellular interaction. The fibroblasts say to the melanocytes produce more pigment. And by decreasing the senescence of the tissue, we decrease this inaccurate cytokine release. So again, melasma, very hard to treat, just with application of growth factor and brightening solution that will contain tranexamic acid and decrease senescence of cell, you can get wonderful and long-term result. So I will close my discussion with the end parameter to speak about, and it is about the hair, treating the hairs. I like to treat hair, and I like to make the hair regrow. And I do it by understanding the anagen-catagen cycle. We know that some pathway control the transition between catagen to anagen, and some pathway control the transition between anagen to telogen or telogen to anagen. And by knowing this pathway and taking the best growth factor that can change the pathways and can change telogen into anagen, I can create regrowth of the hair. With FGF, I can increase growth, I can increase the anagen, because FGF is major stimulatory growth factor for follicle matrix. TGF-beta 3, unlike TGF-beta 1 and 2, is also regenerative. TGF-beta 1 and 2, no, they are anti-regenerative for the hair. But TGF-beta 3 is regenerative. And of course, Nukin, which is a very powerful growth factor, it's found mainly in the embryological tissue, but it found also in the regeneration by the air solution of anti-age. So I start by injecting. I'm always using also PLP, and I will tell you in a minute why, but I'm starting by injection. And then I add microneedling, and on the top of the microneedling, I am delivering topically the solution. Okay, it can be exosome, it can be biosome, it can be air solution, whatever you like, everything can be applied. For hair growth, same. I inject the PRP, then I use some mesotherapeutic agents, so I inject also some type of mesotherapy that contains zinc and copper and other ingredients. And then I end by microneedling and delivery of some regenerative solution. I'm making all of them in the same treatment. And And the reason to do it is because injection of PLP will treat the papilla, will treat the place that the regenerative topical product cannot be done, right? I'm doing application, the regenerative product will penetrate just superficial, but deep, no. This is why I'm injecting PLP. Then I'm using also the mesotherapy because cells need good microenvironment, and I finish by application after microneedling of the best growth factor that will result in the most stimulation. I am using everything to get good result, but most important, fast result. Because with air, people see result very slow. After treatment, for treatment. With one treatment, you can get very good result when you use good stimulation. PLP alone as a standalone is not good enough because PLP alone is inflammatory. You can see in the PLP interleukin 1, TNF alpha and TGF beta 1, they are inflammatory. So using PLP together with regenerative product like anti-age, it's better than using PLP as a standalone. Speaking a bit about the home care product, so anti-age biogel, I'm using it in the clinic. Okay, I'm using it inside the clinic, and I'm using it because it contains a growth factor that called the human beta-defensin 3, which is an antimicrobial peptide that decreases the inflammation, decrease the complication for let's say, for infection or some proliferation of bacteria, and also make the cells behave better after ablation. So I will always use the biogel, always after some treatment. And let's take, for example, this patient. This patient was treated with very, very high parameters. So with a Tixel, with very, very high parameters. And this is 24 hours, like nothing, like she did nothing, no procedure. This is other patient to compare. This is what I expect. After this parameter with the Tixel, I expect this result. But no, with the biogel, you get less inflammation, very good healing. It's good for every energy-based device to increase healing, everything. And what about the home care? So I always send the patient with good home care. Because the home care contains product that does not exist in the daily routine of patient. Daily routine include moisturizers, but what about growth factor? What about retinol alternative like bakuzinol? What about niacinamide, which is a good antioxidant? And treating the skin is not one night stand. Treating the skin is long-term relationship. You need to always take care of the skin. So making one treatment in the clinic is not enough. Patient need to keep treating at home. This was a study that checked only the home care product, and you see improvement in both subjective and objective and in every parameter, in pigmentation, in retids, in spots, pores, the texture, everything changed just from home care. So putting inside also the in-clinic treatment make it much more effective. The key to the hair, to the lashes, and to the eyebrows, it's the same like the home care. Treating only in the clinic, not enough. You need to add also treatment at home, and these are the key. And in this study, this is what they checked. They combined the treatment with the kit and also with the in-clinic treatments of the hair solution, and you can see 12 weeks and 24 weeks, both subjective and objective, no drop of the hair and increased hairs. So it's an amazing product. So my take-home message, use always high quality product. Use always good, verified and researched growth factor. If you use exosomes, make sure that it's good and that it was tested like anti-age and DX, and it is real exosome. Why? Because patients today in the area of exosomes want the best treatment that you can give them. They want not only nice result and good treatment, they want the best. And to give them the best result, you need to use the best product. You need to use the real exosomes. So thank you for listening. These are my references.